Welcome back to my channel. I'm Nefertiti duPont. I'm a board certified gynecologic oncologist, and I am passionate about teaching women how to improve their lives. And I believe this starts with great health. September is Gynecologic Cancer Awareness Month, and today we're going to talk about the 5 most common cancers that affect women with gynecologic cancers. If that sounds good to you, please continue watching. So the 5 gynecologic cancers that I treat every day, day in, day out, are ovarian cancer, uterine or endometrial cancer, cervical cancer, vaginal cancer, and vulvar cancers. So today I'm just going to talk a little bit about each of those cancers. What are some of the symptoms and what are some of the treatments? I'll go into greater detail later this year on each of those cancers, but now since it's Gynecologic Cancer Awareness Month, I just want you to be aware of some of the cancers that affect women. I do see all too often women who don't see their OBGYN doctor or women's healthcare provider very routinely. I've had some patients that once they've had their last child, they don't go back to see their OBGYN. And I definitely don't want that to be the case for you. Now, while you don't need a pap smear every year, and I think a lot of women think, oh, well, I'm going to get my pap test, and that's the purpose of going to the OBGYN doctor. Well, there's a lot of different reasons to go to the OBGYN doctor, and there's so much more that they can offer you besides the pap test. And as the pap testing has gotten better, we actually don't need to do it every year anymore, but we still want you to see your gynecologic provider or your women's health provider just to keep your GYN parts healthy is kind of how I talk to patients about it. So first we're going to talk about ovarian cancer. We've talked a lot about this in previous videos, but ovarian cancer is a very rare cancer, but it does affect women who have ovaries and those who maybe had their ovaries removed, something called primary peritoneal. So the collection of ovarian cancers really include 3 cancers. One is ovarian cancer, cancer of the ovary. The second is fallopian tube cancer, the tube that kind of is a carrier for the egg, and it's where the egg and sperm meet for fertilization. And then also primary peritoneal, and that's cancer of the lining. So sometimes we'll see women that have maybe their ovaries removed and they still get a kind of ovarian type of cancer. That's usually a primary peritoneal cancer. The cancers all lumped together, and we sometimes interchange them and just say ovarian cancer just for like a broad description, but really they're a little bit distinct: fallopian tube cancer, ovarian cancer, and primary peritoneal cancer. Well, some of the symptoms of those ovarian type of cancers are abdominal pain, bloating, feeling full faster, especially after eating. I've had patients tell me that they eat a few bites and they just feel full. Urinary symptoms such as urinary frequency, or having to go to the restroom more often. Some women get upper gastric pain or heartburn type of symptoms. And those are related usually to the mass effect. So as the ovaries get bigger, sometimes, they'll press on the bladder so it won't be able to be as full for as long as it used to be. Kind of like when you're pregnant, you go to the restroom a lot. Same thing when you have masses in the pelvis. The treatment for ovarian cancer does depend on the stage, but most of the time it's surgery. Sometimes we'll give chemotherapy first and then surgery, and we'll talk about that later in some other YouTube videos. But for the most part, we use surgery and chemotherapy to treat ovarian cancers. So the second cancer, which is actually the most common gynecologic cancer that we see, is uterine cancer or endometrial. Sometimes we'll use those terms interchangeably. Now, uterine cancer starts in the uterus, and so most women know the uterus or the womb is what sometimes we'll say. And usually the symptom is abnormal bleeding or postmenopausal bleeding. So I was taught when I was a medical student that postmenopausal bleeding is endometrial cancer until proven otherwise. So if you're having bleeding after menopause, it doesn't mean you have endometrial cancer, but it definitely means that your healthcare provider is thinking about that and doing, biopsies or a test to evaluate the possibility of a cancer of the uterus. So definitely, if you have any abnormal bleeding, especially bleeding that's starts after menopause. And usually we define menopause as having 12 months without any cycles. So if you have bleeding after that, that is abnormal, and definitely see your healthcare provider. The one good thing about endometrial cancer is that most of the time it's caught early in stage 1 because women know that bleeding is abnormal, and they usually will see their primary care doctor or their GYN doctor right away. The third cancer we'll talk about today is cervical cancer. And so cervical cancer is one of the cancers that I treat as a gynecologic oncologist. Now that usually starts on the cervix. Most women have heard of cervical cancer because we talk a lot about pap smears and HPV vaccine. Well, the pap smear is a screening test for cervical cancer, and it's an excellent test. But I do notice that women sometimes they get busy with life and they don't get their routine screening. While we don't need pap smears every year anymore, you definitely do need to get routine pap smears, whether it's every 3 years or 5 years. It'll depend on your history and it'll depend on some of your prior paps. So definitely see your doctor if you've not had a pap recently. Another cancer that affects the GYN system that we'd like to talk about today and make sure that you're aware of is vaginal cancer. Vaginal cancer is very rare. It usually starts in the vagina, and typically women don't have symptoms. Every now and then I'll have someone that presents with bleeding or they'll notice a lump in the vagina, but most of the time vaginal cancer is picked up either by your OBGYN doing, a well woman exam, or because someone feels like a lump down there. Vaginal cancer is not very common, but it is a cancer that your OBGYN can evaluate you for. And then the last cancer, it's not the only cancer, but it's the kind of the fifth most common cancer that we treat, and that's vulvar cancer. Vulvar cancer usually affects women in the older ages, not always, but usually it does. Usually women will feel a mass or a lump. Sometimes they'll have itching on the vulva if they've got kind of precancer changes of the vulva, or they'll have abnormal bleeding. So vulvar cancer isn't as common, but it's definitely something that your OB-GYN doctor or your healthcare provider will look at when they're doing your well woman or your physical exam. So that's all I have for you today. Again, I'll go into depth of all of these cancers later in the year, but just keep in mind the cancers that I want you to be aware of. So ovarian cancer, uterine cancer, cervical cancer, vaginal cancer, and vulvar cancer. So if you haven't pressed the subscribe button, please press the subscribe. If you like this video, please give me a thumbs up, and I'll see you next time. Goodbye.